My name is Aminah, and today I'll be discussing the case involving Dr. Abraham Bergman and bicycle helmets in Seattle. I hope you enjoy, and let's begin. So, we'll start by gathering background information. So, bicycle accident injuries have accounted for 500 to 600 deaths per year, and this is due to bicycle accidents and falls. Even patient HM, who is very influential in psychology and neuroscience, had experienced seizures as a result of a bicycle accident when he was younger. And Dr. Abraham Bergman, who is a pediatrician, was incredibly frustrated by this, and so he decided to start an initiative within his hometown of Seattle, Washington, to help influence and motivate younger elementary school age children to wear bike helmets and to implement good safety habits. So, moving on to step 2, which involves analyzing the current situation. After discussing with many parents about their children and their habits of wearing bicycle helmets, Dr. Abraham Bergman noticed 3 things that were the foundation for his campaign. So, the first thing was that many parents had no idea about the risks of riding a bicycle. The second was an economic factor, which was that many couldn't afford a bike helmet. And the third was a social factor, which was that many children were afraid of wearing a bike helmet in fear of judgment from peers. He then organized and became co-founder of the Harborview Injury Prevention and Research Center, and their mission is to provide education about the issue, train researchers, and just do research to learn about consequences of bike injuries and the best way to prevent them from happening. So now we'll dive into the SWOT analysis. So as a strength, the Seattle Children's Bike Helmet Campaign resulted in an 85% decrease in head injuries and resulted in an 88% decrease in brain injuries. And an opportunity that helped push the initiative was just collaborations with so many companies and orgs like the Toys R Us, Boys and Girl Scouts, and even McDonald's to keep kids engaged and excited. A major weakness was that this initiative was only targeted towards kids and not teens or adults, which is a big limitation. And then a threat to this was just that it was difficult to make this a nationwide campaign, since a lot of companies were open to collaborating but just didn't have the funding to be able to invest further into the program. So now moving into prioritizing core issues, the 3 main causes of bike injuries are collisions with motor vehicles, collisions with objects, and collisions with other bikes. And with 80 to 90% of kids owning a bike in their lower elementary years, it's really important to keep these kids safe. So as mentioned previously, these are the core issues, and the first being lack of parental awareness was a big problem, because if parents don't know about the risks of bike injuries, then they won't encourage their kids to wear a bike helmet either. Next was incentivizing children wearing bike helmets. So a lot of kids were afraid of wearing a bike helmet in fear of being judged by their peers, or they thought it was just too childish to wear one. So offering them with incentives was a great way to keep them motivated. And then lastly, as mentioned previously, it was difficult to cut costs for for the bike helmets, because a lot of them were starting at just $40. So we'll discuss the initiatives and alternatives, and we'll start by discussing the solutions that were implemented in the case. So the first was local news interviews. So ABC News and local news outlets had met with parents of kids that had experienced these injuries to help spread awareness. VMX and ProTech for number 2 had helped disperse free bike helmets and cheaper bike helmets to kids in schools. Institutional campaigns like McDonald's helped give free fries to kids wearing helmets. And then Toys R Us helped manufacture a cheaper helmet model. And then the 16-member coalition was pretty much a group of individuals from the public health department in Seattle, the mountain safety research group, and people who were in charge of like athletic gear manufacturing. And these people collaborated to give more funding and resources for the initiative. And then clubs and rodeos were a really great way to keep kids excited. So they had a mascot named Sprocket Man, and they also gave coupons and even free tickets to like baseball games as an initiative for kids there as well. So now we'll apply the solution of spreading awareness in the context of the trans theoretical model. So this model is used to determine how prepared someone is to achieve a goal and to help tackle barriers they experience. So with the perceived threat, a lot of parents did not recognize the magnitude of the issue, and so the news was used as a way to help them be able to achieve this. And then perceived susceptibility involved discussing common causes and statistics about susceptibility to the issue, and then offering education about this at school, clubs, and the rodeos also helped with this. And then for perceived severity, once again, this is where the news outlets come in play. So this helped to give a lot of awareness to parents and kids about like the injuries and the outcomes of these injuries. And then we have perceived benefits. So wearing a bike helmet was incredibly incentivized, and lots of resources and tools were offered, like discounts, and there was a lot of campaigns initiated by other institutions as well. And then a major barrier was just trying to cut those costs. So being able to bring on like cheaper helmet models from like Toys R Us, for example, was really important. And then for cues to action, there were just so many benefits and incentives for the kids, which were just so many more opportunities and ways for them to get involved. And this whole campaign made an effort to really normalize wearing a helmet in the first place, and that helped improve a lot of self-confidence in kids. So two alternative solutions mentioned in the case was implementing legislation. This was really important because they felt that it was important to have legislation in place to prevent the campaign's impact from fizzling away a few years from that point. And then another was to actually teach kids how to ride a bike properly. So even though wearing a helmet is really important, learning how to ride a bike properly is also equally important and should have been emphasized. And then moving on to providing recommendations. So these three were really interesting. And so the first was using tech and lab simulations to help digitally analyze and showcase head and skull injuries in an interactive way. The next solution was to help target older populations to increase the impact. And the third was to try to make this a national initiative and hopefully try to get some legislative policies created as well. So as an action plan, these lab simulations were created to help analyze and predict and showcase what happens and how to predict a bicycle injury and the outcomes of it. Organizing this into workshops and info sessions would be a really interesting way to help spread the word. Especially in this like current day and age too. And then targeting older populations would be interesting by just doing different sets of initiatives and incentives. So giving like grocery coupons to adults that attend these workshops, having teens organize like community service projects about this or art contests, and maybe collaborating with like race car drivers or influential people in sports to really showcase the importance of wearing a helmet. And then lastly, making this a national initiative would be interesting by working with companies that do want to invest in the initiative. So working with smaller businesses or companies that really just want exposure, and avoiding companies with the full plate syndrome that are already involved in so many other things. And it would also be interesting to work with policymakers to help develop some type of legislation to make helmets mandatory. So the timeline for this would be to spend 1 year to collect info and prepare all the materials for these workshops, a year to implement all of the campaigns, and to ideally implement legislation in the third year. And as final thoughts, so in this case, helmet usage went from less than 1% to 60%, but although it's effective, it's continuing to decline. In Australia, they turned this into legislation and it increased the amount of individuals wearing helmets a lot more, as you can see in these statistics. So it would be interesting to add legislation to this. And this is a major issue and still requires a lot of attention, and moving forward, collaboration and legislation is essential. Thank you for listening to my presentation, and these are my references. Thank you.